Okay, Matt, you are being called to a 25-year-old male in St. Paul's. Okay, it's a stabbing, alright? And you're being called, and that's what you have, alright?
Right, okay.
So make a plan and approach when you're ready.
Right. En route to scene, I'd be thinking about obviously the stabbings, whether it's a single wound, multiple wounds, what we're going to take with us. So it's pretty much going to be everything, including trauma kits, drugs, bags, monitoring, all that sort of stuff.
Okay.
More than likely, we'll get HEMS to run along to this anyway if it's confirmed stabbing.
Okay.
Is it in a home? Is it outside?
It's outside.
It's outside, so probably no problem with egress or conveyance or anything like that. Major trauma centre, which one are we going to go to? On approach to scene, is police on scene? Police are on scene. They've dealt with all issues going on, so either they've been detained or
Detained.
Yeah.
Here is safe.
No problem. On approach to scene, is there any catastrophic bleeds?
You cannot see any catastrophic bleed.
Right, can I see the wound?
You cannot see the wound, but
Cannot see the
some
wound.
blood.
Right, so there's no knife still in situ.
You cannot see any knife.
No. Right, hello, can you hear me?
Alright, pal.
Slight response, okay. So just going to look in the airway.
Airway clear.
Okay, and is he breathing?
He is.
Is it adequate?
It appears adequate.
It appears adequate. Right, if you guys just want to start setting some bits out, so get some orbs to go in, and just start with the trauma thing, we're just going to have a quick look. I'm just going to have to strip you off a minute to see where your wounds are. Can you tell me if you've got any pain?
Yeah, it hurts. I don't know why though, I just open it.
Right, okay. Pulse check.
Okay, yeah, the tachycardia, radio pulse.
Radio pulse, okay. No problem. So just going to strip you off a minute. Anything around your head? Any pain?
Feels alright, pal.
Right, any blood?
No blood on your hands.
No, okay. Checking in his eyes, any sort of pupil dilation or anything like that?
No, they look equal.
All pearl.
Pearl,
Okay.
yes.
Nothing around the ears?
No.
Nothing around the jaw?
No.
Okay, checking the neck. Is there any tracheal deviation?
There is none.
Any surgical emphysema?
There is none.
Any veins progressing out?
Yes, both sides you have distended jugular veins.
Right, okay. Any wounds?
There is no wounds.
No wounds. Okay. Can I still see any sort of blood coming out?
See some blood, yeah.
Where is the blood to?
On the floor.
Just on the floor in general?
Yeah, underneath.
Okay. Anything on his back? Any
So-
pain?
It feels a little bit sore, yeah.
Pain? Blood?
No blood on your hands.
There's blood. Right, okay. If you could roll him towards you, if both of you get on here. I'm just going to roll him over.
What are you doing, mate?
We're going to roll you over because I think you got a wound on your back.
I think that he did, yeah. I think
Yeah?
he did.
Okay. So ready to roll. Ready, steady, roll. Looking on his back.
Okay, on his back you see his stab wound
Yep.
with bubbling blood.
Okay.
It's like a stab wound. It's making a noise.
Right. What side?
It's on the left side.
On his left side. Okay. And how big is the wound?
So it's a centimetre wound of about 5 centimetres.
Right. Okay.
There's a clean stab wound.
There's no
Like I said, bubbling around the area.
There's no chest seal now, but I've got to put a chest seal on
Okay, why would you put the chest seal on?
to stop any pneumothoraxes or hemothoraxes and prevent air getting into the wound,
Okay.
and also to cover the wound. Anything else on his back?
You cannot see any other injuries on the back.
While he's just there, while he's over,
Yep.
just have a quick listen.
Lovely. Air entry. Air entry. Slightly reduced. Air entry.
Okay. And if I do a quick tap test.
Okay, normal resonant. Normal resonant. Slightly hypo-resonant. Normal resonant.
Okay. Anything sort of around his lower half?
No, you cannot see
Around
any
there?
other
Any
injuries
pain?
there. No,
No
cannot see
pain.
any.
Alright, if you were to roll him back. On ready, steady, roll. Okay. So just moving down, chest-wise, anything painful around there?
No, it doesn't hurt, mate, no.
No. Okay. Is there any sort of wounds on the front?
Cannot
Any wounds in the front. Right, just going to have a listen.
Air entry. Air entry. Slightly diminished. Air entry. Air entry. Slightly diminished.
Right, okay. Tap test.
Normal resonant. Normal resonant. Normal resonant. Hypo resonant. Slightly. Normal resonant. Slightly hypo resonant.
Right, so I think he's probably more than likely got a hemothorax of some sort. What have we got obs-wise?
So, what op do you want?
SATs,
So sensor now 95.
95. Blood pressure,
Is 120 over 80.
temperature,
36.1.
BM,
5.5.
resps,
30.
30. Right, if we can put him on 15 metres high flow through an NRB,
So why are you giving oxygen?
because it's a trauma, also with the possible hemothorax, that's going to affect his breathing and his chest capacity and things like that.
Okay, fantastic.
Moving down to the stomach, well, the abdomen, is there any sort of pain around here?
That feels alright, mate.
That feels alright? Any distension or anything like
No
that?
distension, feels soft, there's no guarding, no masses.
Pelvis,
Pelvis feels intact,
legs,
feels intact,
and this one,
feels intact,
and arms.
feels intact. Some minor defense wounds on his right arm.
Right, okay. Nothing bleeding aggressively
There's
or
no aggressive bleeding.
nothing like that. Just looking under the armpits as well. Anything under the armpits?
Not seeing injuries under the armpits.
Right, okay. Are you still there? Can you hear me?
Hello mate, yeah, alright.
Yeah. How's the pain at the moment?
It's sore, I'll give you that.
It's sore.
Yeah.
Is
Give me
that?
something for the pain?
Yeah. Is it in your back?
It is, yeah.
In your
Where,
back.
where you went in, I think.
Can you give me a pain score from 0 to 10? 10 being the worst. 11.
Really
Right.
nice.
Okay. So I think about giving him. Well, there's not a lot I can give him for the moment because of the chest injury.
Okay.
I can't give him Entonox. So
What can you give Entonox?
because of the pneumothorax problem, could exacerbate it.
Okay.
So really, it's going to have to wait for either paramedic intervention or HEMS to give him some strong pain relief.
Yeah, good to see.
So reassessing airway,
Airway looks clear.
it's clear. Is he breathing?
He is breathing.
He is still breathing, and level of consciousness has not changed.
Nope, still alert.
Okay. That's about it really.
Okay. So
Until-
what are you going to be doing now? What's your-
For future, we're going to start to package, although would like HEMS to come and have a look at his chest, because have we still got chest rise and fall on both sides?
Still alert.
Still got chest rise and fall. Have another listen.
Okay. So air entry, slightly diminished. Air entry, slightly diminished. Air entry.
And is it any less than what I heard before?
Sounds about the same.
About the same. Okay. So we're going to stay with continuous OBS, continuous reassessment. Yeah, and prepared to package, probably get the scoop and everything ready and hope that HEMS come. If not, we're just going to have to convey as he is with reassessments.
Okay. Brilliant. So, Hems just turned up.
Yep.
And they're going to want a quick handover. You want to do that?
Yeah, that's fine. So we've got a young male. He's been stabbed here in the street. He's got one penetrating chest wound to his left rear. We've sealed that with a chest seal. Got him on some oxygen for the trauma. He is GCS 15. He sort of understands what's going on, does want some pain relief for it. Suspecting that he's got either, it sounds like a hemothorax, but it could be pneumothorax, or both on the left side. Reduced chest sounds, reduced percussion. Other injuries wise, he's got superficial injuries to his right arm. Nothing else to suggest GI problems, pelvis, or other limbs.
Where was the stab wound, sorry?
Stab wound was rear left side.
Any other stab wounds?
No other stab wounds that I can see.
Rolled him at that level.
We've rolled him as well.
Yes, right, thank you very much.
Okay, stop it there.
Yeah.
What do you think?
I thought it was alright.
Anyone think that you missed anything? No. To be fair, I think you've got absolutely everything there.
I could have utilised guys a bit more, but there's not a lot you can do apart from OBS and
I think you
assessment.
utilised it fairly well. If anything